Hi, hello दोस्तों. Today is my lecture, clinical examination of respiratory system. The first examination of the fingers is respiratory rate, cachexia, fever, race, sputum and fetor. The first examination of the hands is the digital clamblings, tartar staining, peripheral cyanosis, sign of occupations and CO2 retention flaps. Jugular venospatial is the elevation and pulsatiles. Face, mouth and eye is where indicate inspections. Deformity, spectral exudatives, intercostal individuals, symmetrical explanations. What is the palpation of the respiratory systems? From the front is the tracheal centrals, crico distance, cardiac apex displacement. Explanations. From the behind is the cervical lymphadenopathy. Explanations. A four type of examination of the respiratory systems: inspections, palpation, percussions and auscultations. What is the percussions? Resonance or the dull is the stony dulls. What is the auscultations? What is the auscultations? Breath sounds, normal bronchial louders or the shortness added sounds. Wheezing, cracks, rubs, spoken voice, vocal wheezing, cracks, rubs, spoken voice, vocal resonance. Absence is the effusion, increase the consolidations. Wide-spreading voice, and wide-spreading lactolipy. Leg edema is the indications from clinical examination of respiratory system. Salt, watery retention, score pulmonale and venous thrombosis. This is the sputum. Serous, frothy, pinky pulmonary edema. Mucopurulent bronchial and pneumococcal infections. Purulent bronchial and pneumonic infections. Blood stains, cancer, tuberculosis, bronchiectasis, pulmonary embolisms. This type deformity is idiopathic of the kyphosis. Kyphosis is the alterations of the spinal cord and scoliosis is the alterations of the lateral abdominal. A picture of pulmonary fibrosis, small lungs reduction explanations, central cyanosis of tachypnea, auscultation spine inspiratory trackers at the base, dull percussions at the base of the high diaphragms. COPD, chronic obstructive pulmonary disease. Use of the accessory muscles. Hyperinflammatory chest is the barrel shape. These types of a barrel shaped chest, auscultation reduce the breath sounds, wheezing, hard sound loadings in the epigastriums. Percussions leave the breathing in the central cyanosis, the prolonged explanations. Reduce the cricocostal distance, intercostal drownings and decrease the inspirations. Cardiac apex is not palpable, loss of the cardiac dullness on the percussions. Inverts the movements of lower lips on the inspirations, low flat diaphragm. More indication of clinical examination of respiratory system is the mouth, face and eye. Tongue is the violent colorish. Patient is the weak, fatigue, prostrations and irritables. Well indications.